Dr. Rajeev Jayadevan. Doctor, good morning. Thank you so much for joining us here on the show. So we're going to come over to you in the next few minutes with a number of questions just to shed light not only on the situation in China, but obviously how it can affect those of us who are in India. So the first question I want to ask you, we've been talking about the BF.7 variant in great depth over the last few days. But more recently, it's emerging that it's possible that the BF.7 is only responsible for about 15% of the cases and that the majority are possibly coming from other variants like the BN and the BQ. Is that an analysis that you agree with, sir? Could you come in here with your own expertise?
Yes, BF.7, for our viewers, is a sublineage of Omicron. It's part of the Omicron family. And it was identified all around the world in multiple nations, Belgium, France, etc., a few months ago, and also was identified in India as expected. But BF.7 did not gain a foothold as expected. Initially, it generated a lot of excitement among scientists because of its purported growth advantage in the countries mentioned above. In the United States, the total count of BF.7 is only 3.9% of the latest sublineage mosaic released by the CDC. Now, if you look at the latest analysis from INSACOG in our own country in India, BF.7 hardly features on it at this time. Right now in India, we are dominated by BA.2.75 and XBB. And I must also add that the caseloads in hospitals are currently down in India. India is on a low tide phase at this time.
Okay, so I also want to understand from you, when we talk again and again of Indians having hybrid immunity because we've dealt with multiple waves, I want to understand from you, as an expert, do you look at that hybrid immunity as being enough to protect us from another severe wave like what we've seen take place in the 2 years previous?
Yes, countries like India and South Africa have extensive hybrid immunity. And for our viewers, basically, it's a combination of immunity that is resulting from surviving a natural infection and when that's combined with vaccination. So that is expected to generate a greater and more durable degree of protection. Now, it's never permanent. That does not stop you from getting infected if you are exposed to someone who has an infection. But it does prevent severe disease to a large extent. So hybrid immunity is considered to be a good thing, all things considered. Now, whether a new wave will happen or not, it is conjecture. It's difficult to forecast. But if you look around the world, Japan is going through a third wave of deaths this year in 12 months. France had 5 waves. So the pattern of this pandemic varies by region. So it's important to be prepared.
All right, so that's where I want to understand from you. Much of the fear that you see from experts is around this conversation of possible mutations taking place when it comes to the case in China. And I just want to understand from you, sir, in layman's terms, how do we understand A, the possible mutation crisis over there, and B, can India arm itself any better apart from, the government announcement or the government suggestion that we all get booster shots and we all hunker down?
Yes, this virus is continuously evolving, and the way it evolves is by adding mutations. The virus adds mutations that are advantages to itself, and it stays away from mutations that make it less fit, if you will. So as we look forward or backwards on a timeline, you can see that more mutations are being added even after Omicron arrived about a year ago. So at this time in India, as I mentioned, it is low tide. Hospital caseloads are low in spite of the circulating variants being XBB and BA.2.75. Most infections at this time are mild, but the worry at this time is about 1/6 of the world's population is about to be infected or being infected by a fast-spreading variant, and we simply do not know the consequences in the immediate term or the long term. Immediate term will be an infection occurring in a large number of people that will be short-lived. That in some instances it will be fatal, unfortunately. But I'm more concerned about the long-term effects. Specifically, I'm talking about individuals who have compromised immune systems, who may harbor this virus for many months, sometimes even 2 years. And that gives the virus an opportunity to study the human immune system and generate smart mutations that help escape the human immune response. So, but that doesn't mean that we're going to have a bad outcome. But these are things that we must be prepared for, and the best time to prepare for is when the times are calm and when our minds are clear. So it is good that we are having an increased awareness being built, also an assessment of our preparedness, as we saw with the mock drill. For those not familiar with mock drills, mock drills are done when there is no problem. For example, a fire drill should be done when there's no fire. It's just to make sure that if a fire were to happen, we will be well prepared.
Okay, Doctor, I just want to understand from you, when you take a look at the numbers when it comes to the booster shots, unfortunately it stands, I think, at about just 30%. 30% of the people who are eligible for taking them have actually taken them. Very different from if you take a look at the COVID vaccination numbers, where I think it's 90% plus. And so there I want to understand from you, do you think that there was either a campaign failure in messaging to the Indian public, or do you think it's maybe an Indian psyche issue here? What do you think essentially can be done to pump up that number?
Yeah, the question has two parts. One is the scientific basis of the boosters, and the second part is what is driving people's response to receive it. So I'll answer the first part first. The science of boosters is basically about any infection, any vaccine will generate antibodies in the blood and tissues, and gradually the levels will come down. And as the levels come down, your chance of getting infected would be increased over a period of time. So someone who got vaccinated a year ago will be more likely to pick up an infection than someone who got vaccinated 3 months ago. That being said, someone who has been vaccinated is well protected from severe outcomes, even in case an infection occurs, for the most part. But there are people in our community who elderly. Yes, you are what is called a vulnerable population, in whom multiple other conditions also complicate the situation. So these individuals who are either elderly or who have accompanying severe disease conditions that put them at greater risk are advised more proactively to receive a booster dose. That is also called a precautionary dose in India. The second part of your question is about what drives people's behavior. I'm talking pure behavioral science here. This is about why would someone go and get a shot? It typically happens when you fear an outcome. Now, people look around and see that COVID is no longer the killer it was during the Delta wave. So with the Omicron being relatively milder, but that's thanks to widespread immunity, people are not seeing the carnage that occurred in 2021 all around the world. So that is one factor. The second factor is people are aware that this virus is capable of infecting again and again, and a booster dose is not going to last them forever. So these are the two factors, I believe, that are keeping people away from taking boosters to some extent.
Okay, Doctor, if I could just ask you to stay with us. I want to go over to Dr. Jayadevan for another question right now. Dr. Jayadevan, the last question we'd asked you touched a little bit on behavioral science, and I want to take to you another question that is off the same domain. We've watched one state government make masks mandatory, particularly for New Year's and Christmas celebrations. And I just want to ask you, in your opinion, particularly with the way in which the Indian public behaves, do you think it's important for other state governments or for the country across nationally to make it important to have masks everywhere? Or do you think the way that we're currently exercising it, where we're tracking numbers right now before making anything mandated, that's the correct approach?
Yes, masks, as we know, prevent all sorts of viral infections that spread through the air. And we are talking here mainly about COVID and also influenza that is in season at this time. And we have data from this part of the world that influenza accounts for about 14% of the respiratory infections. And that can be fatal in older people, particularly if they haven't taken a vaccine for influenza. So to your question about whether mandates are required for a mask. Now, mandates, personally, on a personal note, I am not in favor of mandates because I think, at least the way I see it, it's important to give clear messaging to the public that it will help you. But the problem happens when the public take the lack of mandates as a no. Some people interpret, I'm talking from the layman standpoint, they look at the government's stand and say, the government has not mandated it, so I don't need to wear it. So that is a problem with messaging here. So it's either or from the public standpoint. As to who will need a mask and where it's needed, it's also important to give nuanced messaging. For instance, masks are more needed when we are in crowded indoor spaces. There are small spaces. We're standing inside an indoor stadium, it doesn't matter, or a large convention center. It's really not indicated. But if you're sitting in a small room and having a meal with a bunch of friends and spend a couple of hours there, chances are you'll pick up an infection if any of them has COVID. So that is a situation when you should wear a mask. But then, to wear a mask in a social gathering, it takes a lot of motivation and determination to be able to do that. The other problem I see is when someone is wearing a mask, that person tends to be mocked, and so that person feels compelled to remove the mask against his or her best judgment. And that person might be being a little extra careful because that person is living with someone who is elderly or who has a comorbidity. But the crowd around that person does not necessarily look into all that. They just look at a person with a mask and point a finger and say, look, why are you wearing a mask? That's the situation we must try to avoid.
Okay, Doctor, just stay with us for a second. I want to go back to Dr. Garg right now for a question.
And as Rajeev pointed out just now, that we need to, we have to see that where we can, put the mask mandate. But also we have to create awareness with the real-time examples as well. During this point of time, we can also prevent asthma, so many asthmatic cases in children who are coming, or, respiratory syncytial virus and all that. But, we definitely need to look from a public health approach at the whole, scenario of pandemic. That is important. So we need to be watchful, and we need to strengthen our IDSP platform at NCDC so that, people sitting across, wherever they are, we can be watchful of the situation and we can take care of the public health intervention.
Dr. Garg and Dr. Jayadevan, thank you so much for bringing us your expert opinion this morning on our show. This is the morning show. It's time for a short break. In just a few minutes, we're going to return. We're going to be keeping our focus on national stories.